I do believe today is, let me think about it. Monday, Tuesday, Wednesday, Thursday, Friday, Saturday. I do believe today is Thursday, June 26th, 2025, family. A day that the Lord has given us, a day that we have seen, are seeing, continue to see, and that we will see. So I want to say salutations, and then my favorites, I like to say shalom, shalom to my beautiful family. Now listen, it's been a minute, but y'all know I got to do what I got to do. Okay, Facebook family. Hey, yes, Bella, I'm back. Thank you so much for coming in, Facebook family. But wait a minute, I can't rule out my. Come on now. How can I rule out my LinkedIn family? LinkedIn. I want to say thank you in advance and welcome to the Bella Biz Unplugged. And oh my goodness, YouTube. Oh, y'all, come on, poor man. Show me some love. Show me some love. Thank you all for coming to Bella Unplugged. Now, listen, for my regulars, I want to thank y'all for hanging in there with me. And I know I haven't been on for a minute, but I've been busy, y'all. We'll get into all that. But today, the doctor is what? In. Can we say it together? Okay, come on, Facebook. Let me see some love. Now come on. You're gonna tell me, LinkedIn, you're gonna allow Facebook, my original community, to beat y'all out with the comments. Y'all see I'm sweating a little bit, right? We'll talk about that too. I want to say welcome to Bella Unplugged. And I'm telling you, family, it feels so good to be back up in here. As you can see, I got two handsome, I'm going to say it, handsome men with me today. And we're going to get into that too. But you know what I got to do? I got to show some love to my audience. Come on, bring those comments in. Yep, make me feel at home. Y'all make me feel like I've been missed because I know I have. I want to say welcome and thank you for the Bella Biz program. Now listen, let's get right into it because the doctor is in. He's really here. Now listen, for some of you who've been following me for a minute, going on 5 years now, can you believe it? Since the pandemic, we've seen Dr. Toco a time or two, and then we've also seen me come on and say, a doctor's not in. You know why? Because he's a real doctor. And you know what? His patients come over me, and they should, okay? So anyway, thank you for coming in to Bella Biz Unplugged. Let me tell you something. I'm going to pump the brakes because I'm already excited. But I'm going to talk about these two men, okay? First of all, as you can see, the guy in the scrubs is a doctor, if y'all didn't realize that. That's Dr. Toco. I'm going to tell you a little bit about him. Then we're going to talk about my co-host. I sure do, family. I have a co-host today. Well, let's get back and talk about Dr. Toco. Dr. Toco is originally from Pittsburgh, Pennsylvania. He received his undergraduate degree from Morehouse College in Atlanta, where y'all know I live, okay? When he graduated with honors. He attended medical school at Case Western Reserve University School of Medicine in Cleveland, Ohio. Let me tell you something. That's just a smidgen, because I will be remiss if I didn't say a little bit about my doctor. And did you hear me say my doctor? Let's get down to it, family. I have a cardiologist, and y'all better look it up if you don't know, because he does a lot of things, but he is my cardiologist. Now, that's all I'm gonna say for right now. But I got another gentleman right here. Oh my goodness. I'm sweating, y'all. I'm really sweating, and the air is on, okay? Now, to my left or right, depending on what device you're on. So lean in, family, lean in and share this segment. Come on, YouTube family, share this segment. Give me some hearts, give me some flowers. Now, LinkedIn's a little different. Y'all can just give me a raised hand because it's a little more sophisticated, it's a little more professional. But my Facebook family, can you blow me up? Can you blow me up and share? Now, this gentleman, I don't even know what to say. And I'm going to take my time. Y'all know why? Because it's my show and I can do whatever I want to do. This is Pastor Ernest Bryant. Ain't he good looking, y'all? He not only good looking, he is my brother from another mother. Start with that. He is I'm getting ready to throw something on y'all. He's my digital pastor. He is my digital pastor. Now, if you want to know what that's all about, DM me in my Instagram. I'll tell you all about it, okay? Something called the Prayer War Room. But DM me, and I'll tell you more about it. But Ernest Bryant is going to be my co-host for the day. Before we get into it, and as I do my salutations, Ernest, come on off that mic. Greet my wonderful family. I have YouTube here. I have my Facebook family, and I also have my LinkedIn before we go head to head with Dr. Toco. Come on for the first time on my platform and greet the people and say a few words. Pastor Ernest, I'm going to give you the mic. It is yours, sir.
Oh man, I wish I had one of those sound effects with the applause and all of that. The way you big me up right there. That's thank you so much, my sister, and I'm speechless. I'm just honored to be co-hosting with you here from New York City. I'm ready to play the Alicia Keys. Let's hear it from New York. You know, you got to rep wherever you're
Mhm.
from. You got to rep it, all right? You got to rep it. And so, thank you so much, and it's just a pleasure to be here with you, co-hosting, and I look forward to diving into the conversation. And big up to everybody that's on our sister Bella's social media, LinkedIn, Facebook, uh, everybody else, YouTube.
Yeah.
You in for a good show.
Oh, they ain't saying nothing yet, Ernest. Now let's get into it because see, people need to understand the doctor's time is valuable, y'all.
Yes,
So
yes.
we're gonna get right into it. I'm gonna ask a couple of questions. Y'all come on with the questions because y'all know I love interaction, right? Right? I love interaction. So please chime in. And I want to say this. This is a disclaimer. Dr. Toco is a cardiologist. He will share to the best of his professional ability general information. Did y'all hear me say that? We not on this stage to fix nobody, okay, y'all? Go see your regular doctors. But what he's going to do today is share some very important tips. I'm going to let him freestyle and share what's on his heart. But please ask general questions about health and heart. And without further ado, I'm sweating up in here. Woo, I need to take some more water. Dr. Toco, come on off that mic, greet my family, and share for the first few minutes a little bit about yourself and what you do, Dr. Toco. The
Well,
mic is yours, sir.
the first thing I have to say is thank you for inviting me back to the Bella Biz Unplugged because it's an honor always to be here. It's an honor to be here one time. It's definitely an honor to be here for the third time. It's amazing that you've been doing this for 5 years. You've touched a lot of people, reached a lot of people in different ways, and I'm excited to see this and excited to see you and Pastor Ernest. So we have a whole. This is going to be an exciting discussion. So I'm excited about that. So thank you very much for inviting me. Just a little bit about myself. I'm a cardiologist here in Atlanta. I do cardiology and cardiac electrophysiology. That is heart rhythm cardiology. So, it's one of those things where for me, as we've talked about, it was always important to be able to take care of people. And I wanted to find an area of medicine where I could help, things that people with things that had affected me or my family. And so, I have a, grandfather who passed away from heart disease. I have a brother-in-law who's in his 30s who has had a heart transplant and has an upcoming potential kidney transplant. So this is something that touches every one of us in terms of heart disease. And so I want to make sure that I wanted to go into an area where I could help out my friends and family and relatives and other people because I want to make sure that all of us do very well in terms of heart disease and make sure, as you guys know, probably heart disease is the number one killer in the United States. It's something that affects millions of people in the United States every day. And I want to make sure we're doing everything to make sure that we are all as healthy as possible and hopefully live to 110 years old. So we want to do everything possible to make sure we're happy, healthy, and do things to make sure that we live a long time.
Yes, thank you so much for that, Dr. Toco. Now, Dr. Toco, I'm going to give my co-host the honors today. I have a lot of questions, and I'm sure Ernest may have some questions. But Ernest, I'm going to allow you to just take the mic for a few minutes, ask some questions, and then we'll see where we go from there. Pastor Ernest, the mic is yours, sir.
Dr. Toko, I want to say thank you first and foremost for this and for doing what you do. As my sister Bella know that I'm a cardiac patient as well. In 2016, I had a double bypass with I think a cabbage, the short term. In 2014, they put a stent in. 2015, they put a stent in. 2016, they was about to put another one in until the head of the cardiac department noticed that something was clearly wrong, and that's when they decided to do the double pipe bypass.
Mm-hmm.
What I would ask you as a doctor, unfortunately, in the Black community, we're not given much resources on how to deal with our health and when should we seek medical attention. Uh, do you find that there's a how can I say a disadvantage to medical consultation in the Black community compared to any others?
Well, I think this is something that's actually been studied, and when we look at it, both, like even when you look at sort of the areas of cardiology that I do, Black people, brown people in the United States are much less likely to end up going to see a cardiologist, even with the same symptoms, or get referred to a cardiologist. And so it's one of those things that we all have to be vigilant about, making sure that we do everything to, make sure that we have doctors who doctors who are taking care of us, and we make sure that we have the right doctor for us. And so sometimes I see patients who have seen a doctor for 10 years and they say, I didn't really like that doctor. I didn't feel like he had my best interest at heart, that type of thing. There's thousands of cardiologists, thousands of primary care doctors, thousands of, of all types of doctors. Make sure you have a doctor that you feel like has your best interest at heart and is doing a great job and can communicate with you. And it's very different for each person. And so there may be the right doctor for you. You want to find a doctor who communicates with you, listens to you, and you feel like it's the right doctor for you. And just because it's the right doctor for somebody else doesn't mean it's the right doctor for you. So find a doctor who listens to you, understands you, and is the right doctor for you. The second thing is make sure that if you feel like, hey, I really am concerned about this and I need to see a cardiologist, or I need to see a endocrinologist, whatever type of doctor it is, make sure it's someone who's going to send you to see that person and seek that level of expertise. And so making sure that, number one thing, I would make sure that you have a doctor you're comfortable with. Number two is making sure that if you need to see someone, that doctor is willing to send you to that person. Other things that end up being important is just making sure that you are a responsible person for your own healthcare. I always think that the best type of patient, I'm involved in their healthcare, but they're also very involved in their healthcare, because no one knows you better than you know you. And so I always try to work as a partner with each patient to try to better understand them and what's happening with their body and their healthcare, and get information from them that leads us to the right conclusion for them. And sometimes it may be that they, don't need medicine. Sometimes it may be that they need a different medicine that they're on, but I can only do that in concert with each patient, just because they know themselves better than anyone else. And so the point being, finding the right, it is 100% true that when you look at, minority communities, Black communities, brown communities, that there is less referral to specialists, less, that overall, medical care ends up being not as effective for those groups. But we have to make sure that we're also involved in our healthcare to take care of ourselves. To make the system is not optimal, is not the way that it should be, but we also have to be involved and actively knowing our medications, knowing our numbers, like knowing our blood pressure, knowing our blood sugar, that type of thing, and be involved in the process to make sure that we're taking care of the way that we should be.
I have one more question. I've learned over time that, like you just said, we have to be the patient themselves have to be involved. Is there anywhere, like, without becoming an internet afraid? Some people, they get a cough and they go on the internet and they tell you, oh, you're about to die of this or that. Is there like any intelligent place we could go to where we can research like follow-up questions? If you go to a doctor, say I'm experiencing chest pains, and they tell you probably just, you just probably tired. Are there like a place where we could go and like find follow-up questions that would make sure that we hold that doctor accountable to what we're experiencing?
Excellent question. And one thing is, I can't stress enough making sure that when you go to the doctor, you're comfortable with what the doctor is telling you and comfortable with the information the doctor is giving you. And if you're not comfortable, I would find a different doctor, because there's a lot of physicians. You want to find the right physician for you. In terms of resources, now the good thing compared to 20 years ago is there's a lot of great resources out there. But I think, and using those resources in concert with talking to your doctor is actually very important and very helpful. I always feel like the best patient is the patient who's educated about their information. So I think sometimes people will say they hate Dr. Google or hate, WebMD or those things. I think those things can actually be very reputable, very helpful sources, like WebMD and other things can be very, very helpful in terms of getting information about, any type of medical disease, heart disease or other disease. And it's using those in addition to talking with your doctor and finding the right solution for you. So I don't think it's ever a bad idea to research what's going on with you. And even if it's, I had a patient the other day who brought me a printed list of questions. They had typed into Chat GPT, what questions should I ask my doctor about my chest pain? And they brought the list of questions that they found on Chat GPT. They printed out the list of questions and brought the list of questions, and we discussed all those questions. And they were prepared with those questions that they wanted to ask. And I think that was actually a great thing, because there was a lot of questions there that we may not have discussed if they were just, how when you go to the doctor, you have a list of questions, but you don't necessarily think of all those questions at the moment. And as soon as you leave, you think of 5 more questions you want to ask. And so I think coming with a list of questions, whether you get them from, reading WebMD, or you type a list of questions from ChatGPT, and asking those questions to your physician, but I try to make sure you leave with an understanding of what's happening with your health. I think too often we have a system that's so rushed and other things that, a patient can leave and not really have an understanding of what's going on, or not having an understanding of their medicines, or not having an understanding of what they should do to get better. And I think we want to make sure that in any situation, any interaction like that you leave understanding as much information as possible. The way I would think about, the way I think about it for my patients is, I'm a consultant for them to do everything as well, to live as well as possible, live as long as possible, and do as well as possible health-wise. So I want to figure out all the best questions for them to make sure that they have a good understanding of what's happening with their heart.
That's good. That's good. It kind of reminds you of a child. So often we make fun of our children when they give you that, they keep asking you why. If it's a 2-year or 3-year, like why?
Right.
That's actually good, because they want to understand it at their level, and they're not going to stop until you have explained it to them at their level. So that's excellent.
And let me say, I have a 4 and 5-year-old, and sometimes they ask questions that I wouldn't have thought of. So I think sometimes we can think about it like we're explaining it to somebody, but sometimes those questions that you ask add to the situation, and maybe questions that the doctor or myself or anybody else hasn't thought of. And so I think it's always good to ask questions, and and no doctor can know more about the patient than the patient knows about themselves. And so the patient is a crucial part of this equation of finding the right solution to try to create the best possible treatment plan. And so I think it's more of it's a team effort to try to get to the perfect solution for that patient. And it's not the same for every patient. Every patient is an individual, and it's finding the right solution for that person, not the right solution for everybody.
Thank you for saying that, because, sometimes people try to leave it as a cookie cut, especially depending on the community that you're in. It's a cookie cut for each person that walks through that door, but each person is an individual. Just like each fingerprint, nobody had the same fingerprint. Each person have their own, health fingerprint, for lack of better words. And so there's no cookie cut solution or no cookie cut approach to dealing with a person's health.
100%. 100%. Yeah, every situation is different. Every person has a different medical history. Every person has a different personal history of what they've gone through to get to that point. And I think understanding those things is what leads to the right treatment plan for that person. And 2 people may come in with the same diagnosis, but have a completely different treatment plan.
That's awesome. Dr. Toco, I have 2 questions. I want to ask. The first question is this, Dr. Toco. What are some common myths or misconceptions about heart disease? That's question 1. And question 2 is, what recent advancements, if any, in cardiology have you or your team used regarding AI?
Okay, excellent. So in reference to the first question, I think, for all of us, there's so many mixed messages about medicine and health, and especially, healthy diets and that type of thing, that there's a lot of misconceptions. I think a lot of times, unfortunately, what we, the news and the media and other things steer us towards is trying to find some, wonder pill or some, like easy solution. It used to be vitamin E, and now it may be like apple cider vinegar or whatever things are. And not that some of these things aren't good, but there's often not one wonder pill that will make everything better. And really the things that universally help us are sometimes the hardest things, like it's not a pill. Sometimes it's exercise and healthy diet, which a lot of times are a lot harder than, taking, drinking apple cider vinegar every day or doing other things. And so I think, one misconception is that there's a pill that's going to take care of everything for all of us health wise, where the closest thing we have to that is much harder than a pill. which is you don't have to put a plug in for exercising. Exercising. I always tell patients about exercising 3 to 4 times a week for at least 30 minutes. Any type of exercise. Sometimes it's walking outside your house. Sometimes it's it's riding a stationary bike. Sometimes it's walking on a treadmill. Whatever it is, something that you enjoy 3 to 4 times a week. I also encourage people related to exercise to keep their phone in their pocket, and it'll show you how many steps you're doing, and you'll see how many steps you're doing each day. Set a minimum number of steps that you're going to do each day. Sometimes people say, I do a lot of walking at work, but they work 4 days a week, and on those other days they're on the couch. You want to have a minimum amount of exercise, a minimum amount of walking you're doing every day. And so if you say I'm going to do at least 5,000 steps a day, or 4,000 steps a day, or 10,000 steps a day, whatever it is, and you make sure every day that you're doing that many steps, you're getting a certain amount of exercise every day. And then in relation to healthy diet, trying to really make sure, there's so many mixed messages. And as a very general rule, I would say, one is a lot of times the food, if we can cook healthier food at home, that is better than the food when we eat out. Like certainly the fast food and the fried food and that stuff, while it's quick and easy sometimes, it is often not the best for us. So trying to stay away certainly from the fried food and the fast food, not trying to add a lot of salt to your food, not too much of the sugar and desserts, that type of thing. I always recommend people don't have those in the house, only because it's too tempting when it's in the house. Whereas when you have it and it's when you have it not in your house and it's something you had to go out to get, then it's something you eat a lot less of. And then making sure you eat a lot of fruits and vegetables, because we all, in general, in our diet, we have way too few fruits and vegetables. So making sure you do those things. And there's a lot of other misconceptions I think that sometimes come up, but certainly that there's not one wonder pill and really not enough focus on, healthy diet and exercise, just because those things are so important for us to do well for a long time and affect not just the heart, but all the other disease processes as well.
Thank you, Toco.
I'm sorry.
No,
AI.
No, I didn't hear you, Dr. Toco. I think I heard a little static. Just say that again, sir.
Oh, your second question was about the use of AI.
Correct.
So it is like with a lot of things that we see in our lives, like AI definitely impacts what we do a little bit right now, but likely the impact in the future will be much, much greater. Like we hear so much about AI, but in our daily lives, a lot of times we don't see the effects of AI or don't see the things over. Some of it, the AI things are more procedural things in terms of like scheduling and that type of thing, which has been automated because of AI, even to the degree soon, probably for many people, they'll go into their doctor's office and there'll be a recording device there. So instead of writing notes now, oftentimes there's a device that will extract the information from the doctor and patient talking and put that into the note in the medical record. And so as opposed to the doctor writing the note, AI will be writing the note. So a lot of those procedural things have happened. We're still waiting for some of the changes that will hopefully happen with the AI that facilitate patients in terms of, in terms of their medications, in terms of health, in terms of that stuff. So we see some changes, but not the level of change that we hope to see over the next, 5 to 10 years.
Super. Well, Dr. Toco, what I'm going to do, I'm going to let Ernest, you can ask a few questions. There's a lot in the chat. I'm going to get a couple of questions after you, but I really want to turn it back over to my co-host because Ernest, we got Dr. Toco cornered in. Let's get these questions answered. Over to you, sir.
Bella, thank you for bringing up that question about AI, because on last week, unfortunately, being that, being a cardiac patient, I try to stay abreast on everything that's going on with regards to my health and just what's out there new. Last week, Dr. Toco, I saw a doctor, actually doing a surgery. When Bella spoke about AI, he was actually in a different country, and the patient was somewhere else, and yet he was using AI, and it was just amazing because it was like a robot was doing the operation, guided by the surgeon who was totally somewhere else. Have you encountered anything like that as of yet?
Yeah, so I focus on the electrical part of cardiology, so mostly doing like pacemakers, defibrillators, and then ablation or burning within the heart. And especially for that second part, for that ablation within the heart, the procedures can now be done, as you say, from another country. There's a system that uses magnetism and another system that's robotic, and you can do that from another country or from another place to be able to perform that procedure to burn within the heart and get rid of these fast heart rhythms or fast dangerous heart rhythms that people have. Yeah, so it is amazing. Over the last several years, you've been able to do that from a distance, even from another country.
Wow, that's amazing. And just one last question before I throw it back to Bella. With regards to heart patient, what is the difference? With regards to, let's say, heart attack or heart failure or bad arteries between age gaps. Like, are you seeing it increase in younger people, or is it still older people? What is the breakdown with regards to that?
Excellent question. So what we have seen over time is, the risk factors for heart disease that we typically think about are becoming much more common in younger people. And so, the risk factors are, if these things are not controlled, high blood pressure, diabetes, people who smoke, people who have a family history of heart disease, all those things can be, and then people with high cholesterol, all those things can be contributors to forming blockages within the vessels that can cause a heart attack. And so, is it really important to control those risk factors if you have them and do everything possible to try to control those things? And so, what we've seen is, like, if you look at the rate of childhood diabetes, and so this isn't even adults and children, the rate of childhood diabetes is much higher than it has been historically because of childhood obesity and other things. And a lot of that, what we realize is that some of the contributors to those things, a lot of it is our foods have changed over time. When we think about the foods that a lot of our grandparents ate, they ate more natural things that were from that developed locally or were grown locally and that type of thing. Whereas now we have a lot more processed food and other things, especially children end up eating a lot more processed foods and those type of things, which leads to things, those risk factors like childhood diabetes, childhood high blood pressure, all those things. And so we see a lot more of those risk factors in younger people. So then because of that, we see a lot of heart disease, blockages in the vessels, weakened hearts like heart failure in people who are much younger now than we saw even 10 or 20 years ago. And so it's really an epidemic. When you think about sort of, you guys were talking about AI and advanced technology, you would think we'd be getting much better in terms of our healthcare, but we're actually in some ways getting worse, where we're seeing some of these diseases that in younger patients, and we're actually moving in the wrong direction, not the right direction. And so I think one of the realizations that we've had is that, a lot of times we think of things in terms of averages. We think, well, I'm eating sort of what everybody else is eating, or I'm eating what, these other people are eating. And it really, when we look at people who have moved to the United States, often have a higher risk of heart disease, and people who, sort of young people now we see with higher rates of heart disease. It says we really had to be aggressive about doing things differently than we're doing. And that probably that average American diet where people are, frequently eating, fast food and McDonald's and other stuff is really not something that helps us live longer or do better. And so it really is something that we want to avoid. We really have to really think about our diets, our exercise, our other things, and really try to rearrange what we're doing and do it in a different way than we've done it over the last 10 or 20 or 30 years. And so it ends up being, we do see much higher rates of heart disease in younger people now, and likely this, from what we've seen, this may get worse over time because we have so many children affected by high blood pressure and diabetes.
Bella, may I have one follow-up question to that?
Listen, my co-host, you can take it, because in the next 10 minutes, I'm going to let Dr. Toco freestyle and tell us what we know we need to be doing. So take your time, Pastor Ernst. Go on and do that thing.
With the follow-up question to that, do you think that the genetically modified food that we're eating in America is a part of that increase in diabetes, high blood pressure, heart condition, especially when we have food, like we could open up a watermelon and not find one seed in it. We have fruits now that has no seeds in them. So, we know that those are modified food. You have imitation meats. And I know there's two companies, I'm not going to call them out, but there's two companies that are leading in imitation meat that had an adverse effect on my body, to where I had to have medical treatment done. Is that can I be a part of the leading cause of the health today, with the genetic food? And I know recently they just eliminated, yellow dye 5 and these different type of chemicals in our food. Is that all a part of what's going on with the health of Americans today?
Yeah, one thing I always say to people, and I always think about like with my kids is like eating like real food. Like, like you have to think how much of like what we see or what we eat or what's available in the store is, it's like some sort of processed version of food or like meant to taste like a certain food or meant to imitate, chicken or fish or whatever it is, or meant to imitate something else or a flavoring of, something that's a natural thing, a flavoring of lemon or a flavoring of strawberries or that type of thing. And so as much as possible, I try to, and we try to get our children to eat like actual food. So like, for example, the basic things with that is like that people will say is like one is staying on the outside aisles of the grocery store. Like the inner aisles that have the chips and the other stuff and the others, it's all inside the store. Whereas the outside aspects of the store are usually like the meat, the milk, the other things that are less processed, eggs are less processed. And so I think trying to stay with real food as much as possible, as opposed to processed foods. When, I think about, so much of like, me and my family's diet now is really a more limited diet rather than a broader diet. We eat fruits and vegetables every day. And so, for breakfast, usually I eat fruit, like I eat a lot of times for dinner, like dinner last night, we ate, we had made chicken, a day or two ago. And, we take the grilled chicken and we put it in a salad and ate grilled chicken and salad. We often, usually every other day, make smoothies with fruits and vegetables in them, and so have frozen fruit and then spinach and kale or something. And so I think eating real fruits, real vegetables, real food, as opposed to something that comes in a prepackaged in a piece of plastic, something that comes, or so even in restaurants, to be honest, they add a lot of things. Just the cheapest thing in a restaurant is to add a lot of salt, a lot of fat, a lot of other things, just because the restaurant is trying to make an inexpensive item that makes money for the restaurant. But, the food you cook at home, you want to be as careful as possible about and try to eat real food. And a lot of times these sort of imitation foods or flavored foods, end up not being the best for us. And so as much as possible, I try to eat, sort of real foods. We usually eat, fish twice a week, chicken, grilled chicken on many of the other days. We eat salads a lot of days. We drink smoothies a lot of days, that type of thing, to try to eat more real food as opposed to other things. And it's not that we never go out to dinner, we do those things, but trying to at least generally be conscious of these things and trying to eat a healthier option, given, as much as possible.
That's amazing. When you just said that, it reminded me of a book called Vegetation Over Medication. Which is an excellent book. And so
exactly. That, or think about like Eat to Live or
yes.
Food as Medicine, or all these things is like sometimes we're focused on, and there's certainly a place, if you need a medicine, we want you to be on a medicine. But if you don't need a medicine, we don't want you to be on medicine. And certainly, think like sometimes we're saying, I'm going to eat McDonald's every day and take 4 medicines, rather than giving up the McDonald's, which may allow someone to be on 1 or no medicines. And so I think, it's one of those things where being conscious about what we're eating is a crucial part of making sure that we do well for a long time. In general, the things I would think about, things that include that we need to really think about a lot in terms of our health are, we talked about sort of healthy diet and exercise. The other thing is trying to minimize stress, which is one of the hardest things, because the stress is often not in our control. And so like sometimes you have people who are really doing well in terms of their diet and exercise, but they live this very, very stressful lifestyle, which also impacts our health. And so the hardest parts about stress are we can't measure the stress, like with a blood pressure cuff, or like we would with blood pressure, or if we measured with a glucometer, measure someone's blood sugar. We can't measure the stress, but I can definitely say that the effect on people's health is significant of having stress. And we can't always control the stress. A lot of times the stress is from the job or from people around us or from friends or from family. But, sometimes we have to say, like, one of my patients said, I had to learn to say no to make sure that I could, take care of my health. Like taking care of her health was not saying yes to exercising, saying yes to eating a healthy diet. It was saying no to some of the things in her life that caused significant stress. And so I think sometimes we have to be active about saying no, to certain things that are causing us a lot of stress, or doing them in a different way, rather than saying, I'm just gonna accept this and this is what it is. So I think, the stress is certainly a factor, and then the fourth aspect is sort of our sleep. Like sometimes, like we think of a busy person in the United States, we always think about they're working hard, they're doing whatever, they're not getting any sleep. As much as is possible, we want to prioritize our sleep. That's our time for our body to recover. That's our time for us to recharge. All of those things are important as opposed to one of those things. So if someone exercises every day but eats an unhealthy diet and doesn't get enough sleep and has a lot of stress, that is very damaging to their overall health. We want to do all of those things as much as possible in terms of minimizing stress, getting enough sleep, eating a healthy diet, and exercising. So really, really try and do those things. I think with stress, it involves thinking about, what are the stresses in our life and what are the things we can do to change them. With sleep, there's a lot of recommended sleep things that, sort of going to sleep at the same time, not using your phone in bed, not watching TV in bed, like doing those things on the couch, not sleeping on the couch and not watching TV in bed. Like sort of make those separate things so your body knows when you get in bed, you're thinking about going to sleep. And then trying to not drink a lot of fluids right before you go to sleep, just so it'll wake you up during the night. And then if you wake up during the night, trying to stay in bed and go back to sleep, trying to make sure that and then just make sure you get enough hours of sleep. But so trying to do all of those things as much as possible to make sure that our health is good, just because there's nothing more important than our health.
That's really good. That's really good. And I know in 2016, it was stress that almost killed me.
Mm-hmm.
Stress almost killed me. And so that is crucial, eliminate those stresses as much as possible. And I guess that's where I come in ministers of the gospel, coming, right, Bella, to try to minister about how to eliminate, the different stress that are going on in our lives.
Absolutely.
Sister
Well,
Bella, go ahead.
listen, let me tell you something, Ernest. I'm sitting here lamenting a little bit, Dr. Toco, because as I listen, my I want to say my intelligent brain understands what you're saying, but the other side of my brain's like, oh yeah. So Dr. Toco, I'm looking at the time. We have a good amount of time, and Dr. Toco family has a hard stop at 5 p.m. We cannot keep the doctor over. But what I want to do, because the Holy Spirit is moving me, something unusually different. We hear information after information after information. I'm going to speak for myself, family, like I say on Clubhouse. I'm not here to play games. Time is valuable, but we listen. But do we really learn? I'm speaking to myself, family. Shout out to my daughter, because she was just getting on me, Dr. Toco, about my eating habits. So, Dr. Toco, I'm going to do something a little bit different. Ernest, you take the role with co-hosting. If you have a few more questions, go ahead and hit them up. I'm not going to ask any questions from the audience. There's so many of them in there, right? But I am going to get them together. And maybe if Dr. Toco allow me, we can get some general information. But right now, the Holy Spirit is moving me, Ernest. If you have more questions to ask, I want the last 10 minutes, Dr. Toco, to spend. And I want us to lean in. Because a lot of times we hear, but we don't listen. I'm speaking to myself, Ernest. Now, I'm going to share a little testimony. Bella, as you all know me, I have a pacemaker. And a pacemaker has saved my life. And 13 years ago, Dr. Toco, this beautiful man that I look at as my guardian angel, saved my life. Now, I wanted to get a second, third, or fourth period, Ernest, but I said, Dr. Toco said, you can go ahead, but you ain't got time for all of that. So, Ernest, I want you to ask one or two more questions. If not, throw the ball back to me. But I really want Dr. Toco to end this show the last 10 minutes quietly speaking to our hearts, because we know, and I'm speaking to myself, Ernest, because I have to get control, y'all ready, family, over my eating habits. Ernest, Dr. Toco knows I know better, I don't do better. So, Ernest, take the baton. If you have a few more questions, go ahead and ask. But I really want to reserve the last 10 minutes for Dr. Toco to speak from his heart like he's speaking one-on-one to a patient, because, Ernest, we got to do better, right?
Right.
Better. So, boss, back to you. And that's
it's amazing because Bella and I, we minister together, via the internet, and one of the things that we do, we work together in the place called the Prayer War Room on social media. And Dr. Toco, one of the things that the Lord impressed upon my heart as a Christian, and I'm going to ask you two questions with regards to the church. Um, do you see in your practice uh, a lot of unhealthy Christians that come in, whether they, is obesity, poor diet? Do you have a lot of Christians that come into your practice dealing with different health challenges compared to a person who may not consider themselves as a Christian? Is there like what would be the percentage gap between a person who doesn't identify as Christian or any religion compared to a person who identify as a Christian? And the reason why I ask that, because in our ministry, the Lord impressed upon my heart to create a form where, and it's called To Be in Health. Because when we read in the Bible teaches us that God desired for us to be in health. He said, I wish above all that you would prosper and be in health, even as your soul prosper. But a lot of times we look at the prosperity part, but don't pay attention to the to be in health part. So is there like a gap between those who consider themselves as Christian and those who are consider themselves non-Christian? Is there a percentage gap on the health and how much they take care of their health? Because I tell you, Dr. Toco, it hurts me. And as one who's not a small guy, but the last time I went into a restaurant and I saw the amount of just heavy people sitting, whether it's at a Golden Corral or a fast food restaurant, just heavy people just in there gorging. So can you please share with regards to that?
So definitely a lot of thoughts about that. So one thing is one thing you made me think about is like a old, sort of phrase or quote that they said, which is, like just about how important our health is. And it says, one of the phrases sort of that, an unhealthy man only wants a dying man only wants one thing, which is to be healthy. A healthy person wants 1,000 things. But think when you're sick, nothing else matters. When you're somebody who's very, very sick, nothing else matters besides their health. And so we had to really prioritize and think about our health a lot. And think in the Bible, in the Quran, even in the Bible, but it's certainly in the Bible, it talks about taking care of your temple and talks about taking care of your health. And exactly as you say, we sometimes pick a lot of other things from the Bible related to prosperity, but don't think about the prosperity of our health. And so it's extremely important and really very clear from a sense of Christianity, a biblical sense, that we have to take care of our temple, take care of our health. And I think there does have to be a realization that a lot of aspects of our society don't necessarily reinforce taking care of our health. But it is important for us to say we are going to take control of the situation and actively take care of our health. When I say a lot of aspects of our society don't reinforce that, when you're in the restaurant, there may be 2 healthy options and 25 options that are not healthy. Whereas we would hope, in the best possible world, there'd be 25 healthy options and 2 options that are not healthy. So sometimes it's hard for people to find healthy options. And I would say that the one thing I wanted to say about the weight and other things is I think we do focus a lot on the weight. I wouldn't necessarily say it's all related to, I wouldn't focus only on weight. I think that sometimes, people eating a healthy diet, exercising, doing those things is important, but we may all have a different weight if we're doing those things. So I'd say finding the right weight for each individual person is important, but not necessarily like sometimes people are trying to get to someone else's healthy weight. They're trying to get to, 100 pounds or 140 pounds or whatever it is to someone else's healthy weight. You want to find the right healthy weight for you, which may be a different weight than it is for someone else. But doing I have patients who exercise every day who may be physically a larger person than somebody who, doesn't exercise as much. And so, sort of trying to do the healthy habits and get to the right weight for you, not your absolute weight and not someone else's weight, you want to do. And so there can be a lot of people, a young woman who's 100 pounds, who's very, very unhealthy. So I wouldn't only use weight. I would use the healthy habits and those type of things. I would say, I think honestly, this is in terms of, does this affect Christians more than other people. I think honestly it affects, our whole country and, affects everyone. Certainly, for certain religions, people have limitations on what they can eat and other things. And so certainly like if someone doesn't eat pork oftentimes is not the healthiest food. And so that may help them in other regards. But I think this is an epidemic affecting almost everyone. I don't know if we as Christians are worse than other people. I think we as a society, we have not done a great job promoting health for everyone and providing healthy options and getting information out for people to be healthier. I think as a whole society, we need to do better with explaining to people healthy options and then having available healthy options for people and making healthy options, less expensive than unhealthy options. And so I think as a society, we need to do that as opposed to it's as individuals, we have to take responsibility, but also as a society, we have to do better in terms of those things. So that's the general thoughts about how important it is. But I definitely notice what you're talking about, that you see in a restaurant and other things that there's just, a lot of unhealthy options and people are eating unhealthy options. And the other thing I notice with people when talking with, a lot of patients, a lot of friends, a lot of other people is once people get used to eating, certain foods, burgers and, fried chicken and other things. And you feel like, okay, I just love this food so much, I don't want to stop eating it. But the interesting thing is I've had a lot of patients, the more you stop eating that food, it doesn't even taste right to you when you start eating it again. So if people go to eat a burger after they haven't eaten it for a while, it tastes incredibly salty to them, or doesn't taste very good to them. The quality of the meat doesn't taste very good to them. Or if they, are used to eating fried foods and they don't eat fried foods for a while, it doesn't even taste right to them. And so I think we've adjusted sometimes to eating, the foods that are wrong for us and think that that's the only thing we like, where really, healthier food actually tastes better if it's something that you eat regularly. And so, it's a hard thing. What I always recommend to people is, sort of from some people, they say, starting tomorrow, I'm not going to eat any of this bad food. For most people, what works actually better is to say, I've had a lot of patients say on the first of every month, I'm going to make a positive, healthy change and make it a permanent change. And every month, every day, on every first day of the month, I'm going to do that. So I've had patients who for years on the first of the month, if let's say they eat fried food twice a week, they go to say, I'm only going to eat it once a week and I'm never going to go back to twice a week for the rest of my life. On the first of the next month, they may say, I drink sodas or sugary drinks. I'm going to buy half as much soda as I normally do for the rest of my life. The next month, they may say, I was eating fried food once a week. I'm going to go down to once every 2 weeks, whatever it may be. Or they may say, I'm going to walk outside my house. I was doing 2 times a week. I'm going to do 3 times a week, whatever it is. But every month they pick something that's going to be a positive, permanent change and never go back. And over time, they do tremendously better. And so I think at least committing to making those changes once a month at a minimum is a good way to over time become healthier, because someone eating a healthy diet for 3 months is not that important in the span of a life, where making healthy decisions for a lifetime is important.
Amen.
So,
Well, Doctor,
yeah.
you at that, Sister Bell, I know we had that 10 minutes before for freestyle.
No, Ernest. No, I'm looking at the comments. It's so many, my God. The people are saying they love the 1%, Dr. Toco, but I have to be a little biased because I love me some Ernest. Ernest, go ahead, close out with one or more of your questions, and then I will take the baton from you. Ernest, the mic is yours.
No, I'm just so excited about this because, you covered everything that, from older individuals who was a history of dealing with heart disease. Now it's down to even younger people. So we have to be mindful no matter what our age is. Even when our children are born, just be mindful what we're feeding them. And so I have a question with regards to like heart condition. For instance, they told me that my heart is good, but my arteries continue to get clogged. What can be done to prevent that? And I know diet, and everything. But do you find that to be an issue that you can have bad arteries and still a good heart?
And I think what they're probably saying is that your heart is squeezing well and structurally is normal, but you've had blockages in the vessels. And the one way I would think about this, I saw a patient the other day who was 29 years old and had blockages in the vessels like you're discussing and required a stent. And the thing I was saying to him was, and he did smoke cigarettes, but did not, worked out all the time, ate a pretty healthy diet, these things. And I told him, the combination of you smoking, obviously you need to stop smoking, but the combination of that and whatever your genetic makeup is makes it so that you have formed these blockages at a much younger age than most other people. And what that tells you is if you continue doing exactly what you're doing now, you will have more blockages within the vessels. And that you maybe at 35, you have a massive heart attack, and that could be, life threatening. That could be something that you pass away from. And so in that situation, at whatever age, but certainly at 29 years old, if you have blocks in the vessels, it tells you have to do something different than you were doing before to prevent this from happening again. It's like anything. Like if somebody shows up late every day and loses their job, and they go to another job and they show up late every day, they may lose their job. If you're doing the same thing that isn't working, you have to do something different to make it work. And so it's one of those things where I think the way I think about it is, for any of us, any type of, if something happens and you have a medical problem, you need a stent or something else, think of it as a blessing as opposed to a curse, because it's telling you, it's a warning sign where God is telling us we need to do something different to be healthier. And, and the hard part is there may be somebody who smokes for 50 years and never has a problem, but it's saying, for me, I need to do something to be healthier. For me, it's a blessing that, when I was 30, I saw a 30-year-old man who looked like me to everything else, had a heart attack. And I said, boy, I need to, even with all the information in cardiology, and I've been trained as a cardiologist, I realized I need to make sure I'm doing better, because this person who, who's the same age as me, everything else, just had a heart attack. And so, that was a blessing for me to realize I need to make sure that I'm on top of this and do something different to make sure that I don't have a heart attack. And so I think, for all of us, we're all in the struggle together. Every patient I see, every doctor I know, every friend I know, everybody's trying to say, I want to, trying to figure out ways that we can be healthier and struggling to do the right things to be healthier. And it's important that we all sort of actively do those things, really make a plan, and on a daily basis have a plan that, to do the things that make us healthier. And so in terms of some of the things like what you're talking about in terms of some of the things we can do, like, making it like, we plan out sort of what we're going to eat for the week. So we have sort of a general idea of what we're going to eat for the week, because if you come home, if you don't have a plan and you come home and you're starving, the easiest thing to grab is to go buy and eat fast food, or to do something that is not, as healthy of a choice. And so trying to make a healthy choice, make a plan that allows you to have a healthy choice. Or in terms of exercising and working out, I know, every Saturday I usually go work out with my brother. Me and my wife work out usually on the weekend or on 2 weekdays. There's a plan that happens, and I have a plan that works that we know, so that, it can get it done. It's just that there's not a plan. If you're not saying on whatever, Monday, Wednesday, Friday, or whatever it may be, I'm going to go exercise. If there's no plan to do it, then we say, oh, I'm going to do it tomorrow, or I'm going to do it next week. If there's no plan to say, I'm going to walk this many steps per day, and I'm going to look every day to see if I'm walking that many steps and figure out ways to do that, it doesn't work out. And so making sure there's a plan in terms of eating, in terms of healthy diet, in terms of reducing stress, in terms of sleep, and trying to follow that plan as much as possible.
That's amazing. And Bill, I think he did. I think I saw he had the admin look up, the way you looked up, Doctor, like your admin was giving you the.
That's right. You're very observant. You saw the message. I was like, yes.
Yeah.
Yes. That was very observant. Yes.
He's spot on. So Dr. Toco, as we close out, this is why I work with this man 4 years and some change, Dr. Toco. Dr. Toco, there are so many questions. I'm going to put you on blast publicly, Dr. Toco. I am going to get because I have a virtual assistant now. I'm going to get all the questions, general questions, family. We're not going to pimp Dr. Toco out. We're going to ask you to go see your regular doctor. But there's so many questions on YouTube, also in LinkedIn, I'm looking, and also on Facebook. Dr. Toco, can we do this? I'm honest, right? Can I just get these questions together? We'll get together with your team, and we'll try to get some general answers back. And Dr. Toco, y'all got to help me. Will you come back on the show again?
Of course, we'll come back. We can go through all the questions, all those things. Oh, you remind me, one other plug I have to put in is just for everybody trying to make sure, especially as men, women are so good, or oftentimes better at taking care of their healthcare than we are as men. Like when you look in the office, we have a lot more women come than men, and trying to get people not only in terms of your heart health and cardiovascular health, but going to see getting a colonoscopy, for any of the fans of Black Panther, seeing that he passed away from having colon cancer, doing all the things to make sure that your health is taken care of for for women getting mammograms, getting colonoscopy, doing all those things to make sure that your health is taken care of, and that we're actively involved in doing everything, going to see your primary care doctor, getting the cancer screenings, making sure your heart's okay, knowing your numbers. Hopefully everyone is doing all those things because it's so important. You don't want to discover, I've had a number of, friends' parents die of colon cancer and other things because they didn't get screenings. And so really trying to make sure that we're doing everything possible to make sure that we're healthy for a long time. The campaign, the Association of Black Cardiologists, our campaign, I thought this was a great phrase, but in some ways it was very sad that the head of our campaign, for heart health was just saying, that we want grandparents to know their grandchildren. And so we want to make sure we're taking care of ourselves so that we can then take care of our children and grandchildren and great-grandchildren and all those people. And we owe it to ourselves and owe it to them to make sure that we're doing all the things that will take care of ourselves to make sure that we're around to make sure that they do well.
Well, Dr. Toco, as I normally close out, and you know this, Dr. Toco, normally I do this, Ernest. I ask my guests, right? Because I actually visited. Shout out to a lot of my people out there. I'll usually ask my guests, if you were on top of Mount Kilimanjaro, that is one of the largest, highest peak mountains, which I happen to go in Arusha, Tanzania. Shout out to my Tanzania folks, which are 8 hours ahead of us. I usually ask my guests, when you get on top of that mountain that I've been on, Ernest, and you just pray and you just go into a contemplation, what would you say to the world? That's normally what I would do. But Ernest, this is how I want to close out. Well, I got a few minutes with Dr. Toco. Dr. Toco, I have so many friends and partners that I'm looking at. I have a friend, shout out to Felicia, who's a caregiver for her mom. She and her mom are listening. We're talking about baby boomers, and we're talking about our older senior citizens. I also happen to have my own daughter who is with child, and you notice, Dr. Toco, who will bring a baby fully healthy to term. I also have what's going on, Queen Lakeisha, who takes care of her health, and she is a ex-military. Shout out and thank you for your services. Dr. Toco, what am I saying? Pastor Mike is on here too. Pastor Ernst from Uganda. It's so many diverse people, Dr. Toco, from different countries, from old to new and in the middle. But there's a resounding line there that I know God gave all of us. Dr. Toco, I know you've talked a lot, but take these last few minutes, sir. And it's all types of people listening. And for the replays, please listen and give us some what we already know in our hearts. Speak to us, because Dr. Toco, everyone has an opportunity to have a heart disease or issue, and we don't want that. For those of us who have it, for those who don't, preventative, and for those who have it. Dr. Toco, just come on off the mic one last time. I think people respect you, not only because you're a doctor, you're a man of God. And Dr. Toco, just take a few minutes, settle yourself, and speak to our hearts. The mic is yours, sir.
Well, the one thing I want to say, is I'm so impressed by how international your audience is from all around the world. And the second thing is congratulations to your daughter again about the baby. But for everybody, I think that this is an opportunity that we've had a great discussion today, a great opportunity to discuss sort of heart disease in a setting. I look forward to coming back to discuss some of the specific questions people had. But I think hopefully we will take this discussion today and allow it to materialize into changes in the way that we do things. And it doesn't necessarily have to be a massive change tomorrow, but it's at least saying like that, like we talked about, the first of every month, I'm going to make a small change that's going to make my health better. I'm going to walk more outside my house. I'm going to change my diet, those types of things. But figuring out some small change to make every month, the first of the month and every month, throughout the year, to say, I'm going to do these things, these permanent changes that are going to make my health better, because there's nothing more important than your health. And that God tells us, instructs us to, implores us to take care of our health and make sure that we're taking care of others. And so, I always tell people, you talked about some of the people on who are caregivers. And one thing I always think, because I have so many patients who I take care of, and a lot of which are women who are doing such a phenomenal job taking care of everyone else, but they're not necessarily taking care of their own health. And for all of us, we need to take care of others, but we're not able to take care of others if we're not taking care of ourselves. And so from every perspective, from our own personal perspective, from a spiritual perspective, hopefully we will make a change today to make sure that we're taking care of ourselves emotionally, physically, spiritually, and that we're making those changes to make sure that we're taking care of our diet, our exercise, our sleep habits, and the stressors in our life, and actively plan on making those changes to start today, and make sure that's something that we continue every month and every week and every day throughout the year.
Well, y'all heard it from the best, and I'm going to say it's the best because, listen, y'all know Bella. I'm coming out with my 13-year-old self, Ernest. That is the best cardiologist I have in the whole wide world. Yep. And I walk around talking about, yep, I got the best cardiologist in the world. That's F as in Forrest, Michael, Toco. Look him up. He's a bad dude up here in Atlanta, Georgia. Okay, Dr. Toco, I know you have to go. I'm going to wrap up my show. Take a couple of more minutes, talk to Ernest, and speak to a couple of people. But you can drop off anytime. Your time is valuable, and we love you. We thank you.
Thank you very much. Thank you for inviting me.
It's a pleasure, Dr. Toco. I'm gonna be giving you a call, sir.
Sounds good. It was great to meet you. Thank you.
Well, Ernest, before we wrap out this show, I want to thank you, sir, for being a part. And Ernest, I'm telling you right now, I got to have you back. Did you enjoy yourself?
I thoroughly enjoyed myself. I hope I represented well.
You absolutely represented well. I mean, you put on your best behavior, but I hope I represented you well, because I go a little cray on my show there. But I was mild today. I was mild today.
I said Bella's making a polo shirt look good with those pearls on.
Thank you so much. So listen, family, I'm telling you this right now. If you listen to my voice, I want to take my time. Right, it's an hour and 3 minutes in. I did good, y'all. I did good to say thank you for joining us in The Doctor Is In. And along with my co-host, which I'm going to put him on the spot, y'all, you will be seeing Ernest Bryan on a regular here and there. I'm going to try to get back on the regular rotation. It was a pleasure, because I'm telling you, I know this man of God. I love his heart. We share a lot together. Ernest, you're going to be coming back. I know you got 99 jobs. Right now, you're going to have 100, because I'm going to ask you to come back and help me co-host. But is that all right with you, sir?
I look forward to it. It's been really a pleasure and informative. And I love being with you, sis.
I love being with you too. Well, family, you all heard it best. This is Bella Unplugged. We're going to go out with my outro. Let me tell you something. If you want to help me, and I do mean that, you see the ticker down there, please donate. I love to say sow some seeds, because guess what? It's going right back to you. Every single dollar, and I do mean that, will go back into Bella Unplugged for future programming. So I don't beg, right? We don't beg. We just ask for a donation to go and put it right back into this broadcast, because y'all know it don't work off of air and water, right? It don't work off of air and water. So if you want us to come back again, and we will come back, please donate. If you want to follow me and speak to me, hit me up on my DM. That means direct message on Instagram. It's Unplugged. It's Bella Unplugged. And I really would appreciate, like Ernest has done, go to my YouTube channel, subscribe to it, and just check out a couple of videos. This is an area that we do bring motivation, education, inspiration, but more importantly, we keep it real, family. We keep it real. Of all my community, to the Facebook family, to my YouTube family, and to my LinkedIn family, I thank you, because I know you did not have to pick my channel to come on. There's hundreds of thousands of people out there in YouTube land, but you picked Bella. I want to say thank you so much. And if you like my show, please comment. Let me know what you want to hear. And yes, I'm going to get back on this daggone app, y'all. But I've been busy, y'all. I've been busy. Anyway, I love y'all with the heart of God. And I always say it. Y'all know me. Shalom.